A 32-year-old male patient presents to the emergency department with numbness and paresthesia in the hands and feet. He also notices that he has been dropping things and has difficulty climbing stairs. On examination, the patient has loss of vibration sense in the feet and hands and weakness of the small muscles of the hands and foot drop. What's your diagnosis?
Can we just go back to the same for a minute, Dr. Sami?
Sure.
32-year-old male, I would include possibly alcoholic neuropathy, B12 deficiency, maybe intrinsic factor, a pernicious anemia present.
Okay. All right. So we're thinking along the lines of peripheral neuropathy, yeah? List some of the factors that might cause this type of neuropathy. You talked about alcohol, you said B12. In a 32-year-old man, you think pernicious anemia is the most likely cause of B12 deficiency?
No, I wouldn't say that's the first and foremost one, but I would say more associated with probably alcohol in use.
But does alcohol use cause B12 deficiency classically?
No, it doesn't.
Okay.
It doesn't. Can be a nutritional. Yeah.
Right. So who will get a nutritional deficiency of B12?
Patients that are pure vegetarian, which means that it's what they call them, pesco vegetarian or something like that. So pure vegetarians, no meat or dairy products in their diet.
Okay. All right. So how would you classify neuropathy? Do you have any way of classifying neuropathy?
I would go with mild, moderate, and severe, and but I'm not 100% sure in terms of the specific classification, but I would say mild, moderate, and severe with respect.
What kind of nerve fibers do you know about? What do nerve fibers do?
They're efferent and they're sensory nerve fibers.
Okay, so if one is sensory, the other is what?
If one is sensory, the other one would be motor.
Right. And apart from those two, what other nerves do you have apart from sensory and motor nerves? Those are somatic nerves.
Yeah, visceral fibers.
So what are those visceral fibers called? What is that system called? That whole system of nerves that supplies your visceral blood vessels?
That would be a parasympathetic and sympathetic autonomic nervous system. Yeah.
Okay. So that you just that is the exactly. So that is the classification. You have motor neuropathy, sensory neuropathy, autonomic neuropathy, and mixed neuropathy. What's the difference between a mononeuropathy and a polyneuropathy?
Mononeuropathy will involve particularly one nerve, for example, maybe a cranial nerve. However, polyneuropathy, like the previous case, Guillain-Barré, will involve multiple nerves or multiple systems. So the autonomic or the peripheral nerve, motor.
Right. And when these neuropathies involve multiple nerves, what is the classic distribution or the classic pattern in which the nerves are affected?
They would tend to be bilateral or symmetric.
Okay, all right. I'll take that. What do you understand by the term mononeuritis multiplex?
Judging from the name, it involves one nerve that supplies multiple structures or multiple organs.
Good guess, but wrong. Actually, that wasn't a bad guess, but wrong. I'll come back to that in a minute. Can you list some specific deficiencies that are classically associated with neuropathy?
But definitely B12 deficiency is one.
Mm-hmm.
Can have diabetes is a chronic condition.
Now we're talking about
Well,
nutritional deficiencies here.
folate may also have a similar effect as B12 deficiency.
Mm-hmm.
B6
with no, B6. Okay, right.
yeah,
Okay.
and
Okay.
and
All right.
thiamine.
All right. Yeah, which is B1. Yeah. Okay.
Yeah, B1.
Yes. Okay. What are the classic features of vitamin B12 deficiency?
Patients will have loss of proprioception and sense of vibration in the peripheral
Yep.
Distribution. They will also have ataxic gait as a result of their loss of the proprioception, and they may have cerebellar. They may have cerebellar dysfunction, impairment of the dorsal columns, medial limbless system.
Yeah.
That will account for some of their ataxia.
All right. Okay. All right. We stop there. How was that?
A little shaky because I have to review this.
Yeah. So again, I am going to put up a thing on neuropathy for you to listen to. It's a complex topic, but you don't need to know it in great detail. You have to have some kind of classification in your head, which is what we are getting at. I was really glad you got down to saying B1, B6, B12. When you're talking about neuropathy, don't mention B11 first, please, because you're going to confuse your examiners. It's true. What you say is true. Certain types of B11, which is folate deficiency, will be associated with neuropathy, but actually, that is one of the things we use to distinguish between B12 and folate deficiency. But B1, which is thiamine, and B6, which is pyridoxine, definitely cause neuropathy. Vitamin C deficiency, vitamin A deficiency specifically causes optic neuropathy. Vitamin E deficiency can cause neuropathy, and vitamin D deficiency can cause neuropathy. So it's B1, 6, 12, vitamin A, which is optic neuropathy, and then vitamin D and E can cause neuropathy, okay?
Okay.
So yes, you're right about the mono and polyneuropathy. What I was getting at, I accepted your answer actually, but what I was getting at is that, so it is bilateral and symmetrical. And with polyneuropathy, the nerves tend to be affected from most distal to more proximal. So they typically present with a Globan-Stocking type distribution of the neuropathy. Whereas the mononeuropathy usually involves the entire nerve and specific nerves. And mononeuritis multiplex means that you have multiple mononeuropathies either going on at the same time or in sequence. So you have somebody who gets a third nerve palsy, and then soon after they get a seventh nerve palsy, and then they might get an ulnar nerve palsy. It's a very specific condition that affects whole nerves, but more than one of them, either simultaneously or in quick succession. You need to know the classic features of B12 deficiency. And I do like, it does cause, it actually really does cause cerebellar problems, but the real classic stuff is loss of, so it's dorsal column, loss of vibration and position sense, and lateral column, which is the other heavily myelinated column, which is your corticospinal tracts. So you get spastic paresis. So it's a combination of spastic paresis, hyperreflexia, and loss of vibration and position sense. You must know B12 deficiency, and you must have a general overview of polyneuropathy. All right, folks, that's all I wanted to do. I'm going to stop sharing for a second. So I am going to put up some videos for you guys to watch. Please watch it and then use the videos as an opportunity to revise these conditions. CNS is funny, it's kind of esoteric, but they have a few things you must know and know well. Okay, that's the stroke syndromes, spinal cord lesions, polyneuropathy, and CNS infections. Any questions or comments?
No, sir, not at this time.
Okay. All right. So like I said, keep looking in Schoology. I am putting up things for you to look at, and I'm also putting up quizzes. And I really encourage you, please try to just do the quizzes and then read from what you have questions you've answered. You need to focus your brain in. You're just reading a lot of stuff is not going to stick now. Okay. All right. So
Yes,
bye-bye.
okay, bye.